Thanks, Dr. Manjari, for calling a unique function of this kind. For an entrepreneur and engineer, this is an unique because we don't generally see doctors and patients every day as you people are. What Mother Teresa was doing it for the TB patients in Calcutta, probably Samiksha Foundation is doing a bit for the children of the cancer institutes. So Manjari approached me several 3-4 years back that this is kind of organization we are running, and then as usual I have been associated with many organizations, so I have done a small bit of it and not a big philanthropist as such for the Samiksha Foundation. Of course, I have been associated in the first donor to the what is this, Shankara Cancer Hospital when Dr. Srinath approached me then. Coming to the point of today's a gesture to the people who have been looked down upon, or people, if I go back about 30-40 years back, if somebody says it's a cancer, he's been written off. People used to say that, oh, he has been suffered by cancer, that means he's gone forever. So in South Canada, we used to say that if 1944, if somebody comes back and then say, you talk about Japan, he has gone to Japan, that means he's gone. Then like that, his cancer has been carrying that kind of a sensational word. I'm happy that technology and innovations and the doctors, oncologists are involved in this whole process in the whole world. Now today, it is not a very big disease, it looks like, and I know many, like Dr. Bhatt said, I know many people who have survived and lived for many years happily, and like Dr. Sunil was telling that, after the cancer, they're more confident, more fighting the social injustice, more confident people, more because they have come to a life saying that nothing that screw me up, and even I have won the cancer. So this kind of attitude building and happy living has been done. And I visited the Samiksha Foundation's classes in Kidwai when Dr. Linge Gowda was the director. So I associate with Linge Gowda because we have given some philanthropic work there to the hospital by providing those information systems, TVs, etc. But the point that I would like to make is that Samiksha Foundation is doing a wonderful job to the children. I'm so happy that the missed number of years of education is made good by people teaching them, and then the teaching alone is not a great thing, but it is a confidence that the children gets with the with the teaching. I think that's a great service that one can do. Because your back of the mind, you are giving them, saying that, oh, we are somebody's back to back me up. So I think, as doctor was telling, that the boy or girl who come out of this disease, fighting this disease, will be a very good citizen in the society, because he would have gone through that, the pleasure and pain, how to focus the pleasure and pains of the situation. So Dr. Manjari said, you touch upon a few things about what you do and how you do, but I don't want to very elaborately tell that what I do in this whole thing. But I have 1,000 people downtrodden in the society have been employed. So we focus on 50-60% of the people in our company, women, who have not gone to school, and then the downtrodden people. We trying to uplift their quality of life. I can't say that the quality of life is not satisfied by anybody in this country. So it is just like that, happy living and living with smile. Probably that could be my bit of information. Now, in our company, we also do this kind of a thing. Anybody is having any heart patients or any of those kind of diseases, we immediately take care of their health procedures. We are very near Narayana Narayana and Sparsha and all that kind of hospitals in the Hosur Road, and then we have many doctors helping us in doing this, because basically the poverty, as the doctor was telling, make the the family very much negative, and the child by herself or himself become very, 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 stressed. No, no, I am gone case like that. But the Samiksha giving a lecture, an attitude and a positive lecture, probably he or she would come to the mainstream. Um, I continue to support the Samiksha Foundation, and then if it is a 67 people scholarship of 10,000 rupees, is quite a big sum, and then probably you have a direct donation collection methodology. If anything can help, probably I didn't know that this is a very big affair like this. She used to come and then collect some funds, small funds. But I can connect a few people who are doing this kind of thing. I'm also involved in building some leadership qualities in the slum children. I incidentally came from NIT Suratkal. I studied, and one of the Sneha Trust actually what our 84 batch. I am a 71 batch. 84 batch is that done, and it so happened that one of our co-college chap died, and then we took care of the family and given education to the two children, and they are in USA now. And then Sneha Trust now is trying to do in Yashwantpura area the government school children to become leaders. Leaders in English speaking and attitude building exercise and things of that kind. That also similar to this kind of a thing actually. Actually, there is a disease connected to the children. There is a pidugu, pidugu. They will say Kannadalli pidugu. They say so something is attached to those children. We are from the poor, we are from the slum. We cannot learn. We cannot go to engineering college. All that is being removed from their mind to fight the future of the whole thing. Actually, in Jacaranda, in where we stay, also there is some engineer, retired 75-year-old guy having 10 slum children to be educated. And then he finds that the two of them getting engineering seat through CET. So this confidence building exercise by itself is a great gesture you can do to humanity, really. So I thank the directors and the founders, and I read the story of Samiksha. So really that Samiksha, the girl, the 6-year-old girl, who has given a brilliant idea of starting this total trust. I wish the trust to become a big organization to help this kind of people. I was also going through some of the things. Then 38 or 40 people per million are the cancer patients, children patients. That means about 40-50,000 children in this country are child cancer chaps. So there is a big task actually, and probably several trusts like Samiksha should take care of these 40-50,000 children to become the mainstream citizens of this country without really thinking that something happened in the life, and that is only happened and we recovered. So we should forget it. Like for example, in the age of 55, I had 2 stunts and then I forgot about it. Then after 3 years, I had a bypass. I forgot about it, and I am, as usually, I am. So the medical profession has given so much of confidence in the people. I work as usual 12 hours a day, even now at the age of 71, 72. So that confidence building exercise, what you are doing is phenomenal, and I would really thank. The empathy will start from those who have gone through the suffering, actually. Otherwise, everybody will be talking about these 3 words: apathy, sympathy, and empathy. So there are people to talk in this country, a lot of them, apathy and sympathy. What happened? Oh, what happened? That's all. But there are very few people really contributing to the empathetical need of the society. So I wish the group of people who are doing this, and then particularly Dr. Manjari. Thank you, Manjari, for calling this, and I am very happy to have heard doctors, and then really salute to the doctors. Earlier even this cancer means that immunity, etc., come into the picture. Like the COVID, no doctor was coming near to the patients. We are all scared. We were only praying God that these 10 months we should not get even a cold or a cough or a headache. Because if I go to Narayana Narayana, they will not allow my wife to come along with me at this age. So, but doctors have done a wonderful job, and kudos to them. Actually, like doctor was telling, is not a warrior. The warrior, the doctors and the police have become the real warriors of this last 10 months. I really salute them. uh, Thank you very much for calling me and associate with you. And I will try my best to support the Samiksha for many years to come. Thank you very much.